Hey everyone, this is Dr. Casey Johnson. Thank you so much for taking time to listen to the Unlock Wellness podcast. I know you're going to love today's episode with Dr. Sarina Pasricha. Dr. Sarina is doing some amazing work, so I'm excited to have her on to share her story with you guys. If you've been loving the Unlock Wellness podcast, be sure to jump onto iTunes, subscribe, and write a review. It really helps me out a lot, and I really appreciate all of the feedback and support. Also, be sure to follow me on social media to keep up with the latest podcast episodes. The best way to connect with me is on Instagram, Facebook, and Twitter. My username across the board is at Dr. Casey Johnson. That's DrKaseyJohnson. You can also check out my website at drkaseyjohnson.com. It has all of the past podcast episodes and more information about each guest under the Listen tab. While you're on my site, be sure to check out the Shop tab where you can check out my first book of my Healthy Children's Book series. Thank you again for listening. I hope this episode leaves you feeling inspired to start making positive changes to your health. Now it's time for today's episode. I hope you love my conversation with Dr. Sarina Pasricha. Welcome to the Unlock Wellness podcast. I'm Dr. Casey and excited for today's guest. I'm here with Dr. Sarina Pasricha. And Dr. Sarina is a plant-based gastroenterologist and a mom, so I'm excited to hear about her own personal wellness journey, as well as all of the amazing work that she's doing. So Dr. Sarina, thank you so much for taking time to come on. I'm excited to have you.
Thank you so much for having me. I love the education you provide about plant-based diet, and so I'm excited to be here.
Oh, I appreciate that. No, I'm excited to have you. And Dr. Sarina, before we jump into all the awesome work that you're doing, let's start with your backstory. First off, where you're from and what's your own health and wellness journey and your career journey, how that's progressed over time as you've really learned what you've learned about plant-based.
So I grew up in Delaware, and I would say as a childhood, I actually had a very healthy diet and lifestyle. My family is Indian, and so my mom would cook whole food, fresh food, plant-based predominantly growing up. So I was very lucky in that sense. I was pretty active in sports, and so I think, and we'll talk about the gut microbiome later, but I think that I had a pretty healthy upbringing. Now that kind of changed when I went to college. Like most people, I definitely ate a lot of processed foods, was eating late at night. I'm a very social person, and I was one of those people that I would start my breakfast in the cafeteria. I would hang out, talk with people. I would stay there for lunch, hang out, talk with people, and then it would be dinner time. Next thing I knew it. And so I was eating a lot of processed food and probably like the typical American diet. And I went to school at Harvard, and I was actually studying nutrition, and I was majoring in biological anthropology, which is a really cool field. It actually, you're studying health in a social and ecological context. Despite that, though, my diet itself was not very good. So then I went to medical school at Northwestern, and even though I was a physician in training, again, my diet was not good. I ate a lot of processed meat, fast food, meals. I always had an interest in gastroenterology and GI and gut health. I actually took a year off at that time and did something called the Howard Hughes Medical Institute Fellowship. This is a National Institute of Health, NIH, 1-year funded fellowship. And I was working in the lab looking at mice and their diet and whether a high-fat, high-calorie diet caused more of these mice to have fatty liver disease. And I was trying to understand some of the genetics behind who develops fatty liver disease and is diet related. Again, not really making that connection, though, that my diet would matter to me. So it was like all very scientific. But I was like,
all these poor rats, but then you're
that's right. It's like, it's about them. And like, I was like, that's not me, that's not happening. Right. And then I moved to University of North Carolina, where I did my internal medicine training and my GI fellowship. And, after high school, I did 16 years of additional medical training. And it's 80 hours a week. My lifestyle was
Wow.
horrendous. I'm not sleeping appropriately. We're working night shifts, day shifts, eating on the go. My favorite food was like pizza and, just definitely not having a healthy lifestyle. And then I did my gastroenterology training. And at that same time, I became pregnant and started having my kids. So I have two girls. They're 3 years old and 5 years old. And I started to learn a little bit about the gut microbiome and gut health. And I'm sure many moms can relate that, when it was just me and my life, like I didn't take care of myself as well as I should have. I wasn't exercising regularly. I wasn't eating appropriate food. But the more I was researching this field, I started to realize that, what I eat and how I take care of my body is going to affect my children. And that's when I made this life change. Once I knew it was going to affect my kids, as moms, I think all of us are doing the best we can to try to give our kids the best and healthiest lifestyle that we can. And I started to do research about diet and nutrition. And I'm an adult gastroenterologist. So my background and currently I'm in a private practice group and I see patients all day, every day with reflux, the heartburn, abdominal bloating, discomfort, nausea, vomiting, constipation. And I do procedures on these patients. So I do endoscopies and colonoscopies. I'm trying to remove precancerous polyps. And I realize that the medications that we are giving our patients are, in essence, a Band-Aid. We're helping their symptoms, but we're not really treating the root of the issue. So that kind of began my journey into what can I do as a mom? What can I do as a physician to help my family and my patients feel better, get better, and just overall live a healthier, better lifestyle. And that's when I started to switch, because like I said, I was a pretty heavy meat eater before, and was eating, the average American diet is 60% is processed food, 30% is dairy and meat, and then 10% is fruit and vegetables. And that was pretty much my diet for most of my, adult life, my adulthood. And when I looked into the research and studied a little bit more about this, I started to switch. So now I'm a whole food, plant-based gastroenterologist. And what that means to me is that I try that 90% of my food that I intake comes from fruit and vegetables and whole food. And slowly I'm making that transition. It's a very gradual process, but that's kind of my journey and why I have kind of changed my lifestyle and my diet.
That's amazing. No, I love that so much. And I mean, for you, how did you even find that? Was it just going through the research of what was working best, or did you kind of go back to the research that you had done with these mice, or what was like that click for you when you realized that was the better option?
It was a few things. One is my patients were coming to me and my patients were saying, I have heartburn and reflux. I don't want to take these medications for the rest of my life. Or they would say, I have irritable bowel syndrome and I don't want to live like this forever. And then it was, as a mom, what can I do to make sure that my kids have the healthiest lifestyle? So all of those things, I really wanted to delve into the research to help my patients. So although I had, interestingly enough, a little bit of a nutrition background, I really had to go into the research now, because the truth is that the gut microbiome was not, we didn't know about it 10, 15 years ago.
Right.
This is a really real new concept. And, every single day there's more research about the gut microbiome and gut health. And so maybe we can just talk a little bit about that, just so that people really understand.
Because I mean, it's powerful. And I mean, just the effects that your gut health has on, I mean, your entire health. I mean, even like gut-brain connection, it's ridiculous how powerful it is. Yeah, no, I would love for you to dive into that.
Yeah, no, that's so right. So the gut microbiome is an ecological community of bacteria, fungi, and viruses that live on and in our body. And, like most of us, we think, bacteria, viruses, I don't want that in my system. Like, that's disgusting. Like, I'm a clean person.
Right.
But that's not the case. Like, these bacteria are really important. And we all have good bacteria and bad bacteria. And when that is in balance, then we are healthy. But the studies and the research are showing that when that is not in balance, and when we have more bad bacteria than good bacteria, that is linked to nearly every chronic inflammatory condition. So that is linked to atherosclerosis or heart disease. It's linked to arthritis, cancer, obesity, inflammatory bowel disease, like literally every inflammatory condition you can think of.
Right.
And actually, my favorite study, just to like highlight how important this is there was a study that was actually done out of Harvard, and they took poop from twins. And one twin was thin and one twin was obese. And they took that poop and they put that poop in mice. And these mice lived in sterile laboratory conditions, the exact same environment. And they found that the poop from the obese mice turned the poop from the obese twin turned the mice obese, and the poop from the thin twin turned the mice thin. And so again, right? Like, I think that's insane. Like, we don't realize like there are 200 trillion gut bacteria in our body. We have more bacteria than stars in the Milky Way. And we didn't even know this existed, 10, 15 years ago. So now that we know it exists, there's a lot of research to say like, okay, well, what can we do to make this healthy? And we know that if you're unhealthy gut microbiome and gut health, you will have medical issues. But how do we make it healthy? And there's a guy named Rob Knight. He's out of UC San Diego. And he did something called the American Gut Project. I don't know if you've ever heard of this.
I haven't.
So he basically took poop samples and collected poop from Americans all across the country. And so this is not in like a laboratory setting. This is real life. He collected their poop samples.
I'm just like imagining how that conversation went.
Yeah, because he wanted to see like a typical American, like,
right.
If we take people and we're like, oh yeah, eat this, exercise, like we can kind of control stuff. But like, let's see what is everybody doing. So he collected all these poop samples and he analyzed it. He's a scientist and a researcher. And he found that the single greatest predictor of good gut health was the variety and diversity in fruits and vegetables that we eat. And so when I heard that, that was eye-opening to me. And like I said, I was probably having 10% fruits and vegetables in training, and I should be having 90% fruits and vegetables if I want good gut health. So that research and some of these findings that were coming out really kind of made that switch for me, because I just think it's insane. I think that in the next 5-10 years, we're going to find out even more about our gut microbiome. And I talked about that study at Harvard where they took poop samples and put it in mice. But the truth is, like, there's a bacterial infection called Clostridium difficile, C. diff. I don't know if you've ever heard of that.
I have, yeah.
Yeah, and so it's a bacterial infection that causes pretty significant diarrhea and inflammation in people. And nowadays we do stool transplants and poop transplants to cure that. So it's just insane how our poop is so vital to our health.
That's insane. Wait a second. So to go back on the poop transplants, let's go back to that route for a second.
Sure.
So how does that work exactly? And is it just for people that have that condition, or are they doing that with people that have, let's say, like a condition like cancer? Like, are they using this in other like medical conditions as well?
Yeah, so right now it is only FDA approved for Clostridium difficile, C. diff bacterial infection. And actually, it's kind of cool because things are evolving so quickly in medicine and in gastroenterology that when I was in my training, we were involved in the initial studies looking to see if this was effective. And we would actually have people come into the endoscopy suite with poop samples from a friend or a family member. And we would have them bring their own personal blender, and we would literally blend up the stool, do a colonoscopy, and put the poop in them. And it sounds like so crazy and disgusting, but these are people, you have to remember, that are really, really ill. Like, they have this bacterial infection. They've probably been treated with multiple courses of antibiotics. They're not getting better, and they're not functioning. And so we would do this, and within a few days, these people would turn around and go back to their normal selves. So it's amazing. Now we have a little bit more high-tech ways of doing it. We can screen them properly for infections. And we actually have a national compository so you don't have to ask your friend. We can get it nationally. So right. It better be a good friend.
Exactly. So what do you know the like success rates of that right off?
Oh, it is. I think it's like 95% successful. Now, the patient population has to be selected very carefully. It was so successful in the research studies that they actually cut the research trials short and stopped the research trials because they said this is so successful that we have to do it this way. So it's very select patients. Like I said, they've had to have failed multiple courses of antibiotics first, and there's other criteria, but it is extremely successful. And there is a lot of research right now looking at poop transplants for like tons of medical conditions, inflammatory bowel disease, cancers, even psych issues, whether depression and anxiety, autism. So right now it's only FDA approved for this one specific infection. We'll see what happens with the research, because it all has to be research based.
Sure.
Especially in my field. So
how do you know right off, and you may not, how responsive, let's say like an insurance company or just higher up, because whenever you start to implement things like that are that effective, that doesn't have a medication label on it, it can get kind of like maybe not push as much because maybe they're not making as much money on it. Do you know what I mean?
Well, we don't have a problem getting it approved by insurance. And I think that's probably because insurance companies realize that this technique for this bacterial infection is so effective that it is saving insurance companies so much money from multiple hospitalizations, multiple courses of antibiotics. And we can talk about antibiotics too, because this C. diff infection, we are seeing a rise of it. And one of the reasons people get this infection is from antibiotics. And one course of ciprofloxacin, and ciprofloxacin is one of the most common antibiotics that we prescribe for multiple conditions and a lot of women for urinary tract infections. And one course, like a 5 to 7 day course of that, can wipe away 80% of your gut bacteria for up to 1 year.
That's crazy. And then most people take multiple antibiotics per year since the age of, day one. So it's, that's,
and that's one of the most harmful things for our gut bacteria and our gut health, because the way I look at it is like, if you have a garden and you have weeds and you're going to put weed killer. Yeah, it kills the weeds, it kills the bad guys, but it also harms some of the flowers that you're trying to grow too. And that's the same thing with antibiotics. It gets rid of the infection, but it's also killing off so many of your good gut bacteria. So, antibiotics have been life-saving, and when you need it, you should take it. But I really encourage my patients, and I only prescribe it when absolutely necessary.
Right. Yeah, I think that was, I'm sure you've seen this on your end. I'm not sure, you can probably let me know in more detail, but have you seen with your colleagues a decrease in pushing out antibiotics because of all the research? Because I think back on when I was little and it was like ear infection, antibiotic, strep, antibiotic. And there was just like constant when, so much research shows now with how most ear infections are viral, and that's very, very unnecessary and causing more risk than good. So have you seen a decrease on how much is prescribed by like people that you work with?
Yeah, most definitely. In fact, the hospital that I work in has a huge push right now they're looking at every patient who's being given antibiotics to make sure that there is an appropriate indication. So I think hospitals and providers, and I think even patients, are becoming more savvy and listening to, some of the health concerns about antibiotics. And so, there's definitely been a decrease and more of an awareness that, they're not as benign as we thought.
Right. And like you said, in life-saving situations, obviously amazing, but for a lot of the cases, it's not necessary. But then it's like a perfect storm, Dr. Sarina, because you talk about the effects of antibiotics on gut health, and that's just one factor. We're in such a like go society, right? So we have constant stress. You throw kids in the mix, that's even more stress. And then you have anxiety from work, and a lot of women especially have hormonal imbalances, and like all of these things kind of swirl together, and all of a sudden somebody's like, oh man, why do I have IBS? Why do I have Crohn's? Why am I in constant pain? And it's just like this mix of all of these things together.
And that's so true. I see so many patients with irritable bowel syndrome. And, there is a brain gut connection. We used to think that irritable bowel syndrome was like a psychiatric condition. And I want to be clear, when I say there's a brain gut connection, I do not mean that it's all in your head or it's in your brain or you're crazy. That's not what we mean at all. Our gut has more nerve cells than anywhere else in our body. There are 500 million neurons in our GI system. That's 5 times more nerves in our gut than our spinal cord. And so when anybody, and especially as moms, like when we get stressed, anxious, worried, we're running around with the kids, we're not taking time for ourselves, our gut picks up on that first. And the nerves in our GI system sense that, and they start to spasm and contract. And then you can get symptoms of pain, bloating, gas, diarrhea, constipation. And actually, when you talk about anxiety and stress, 95% of the happy hormone or serotonin is produced in our gut. And so that's often why like people who have irritable bowel syndrome, we treat them with antidepressant medications or medications that affect serotonin. Now that's one way to do it, but alternatively, we can heal the gut from within with taking in fruits and vegetables, increasing our fermented foods, avoiding antibiotics, and reducing the stress in our lives. And we can achieve the same effect by doing some of these lifestyle changes instead of taking medications.
No, that's amazing. Have you come across any good research that shows the effects of like modalities like meditation or yoga on gut health and just decreasing the stress and anxiety that somebody might have?
Yeah, I was fortunate to train with this guy named Dr. Doug Drossman. He is one of the founders of discovering irritable bowel syndrome and really helping us to understand that there's a brain-gut pathway. And so there is actually a lot of research out there, and it's been reproduced multiple times that shows meditation, yoga, even hypnotherapy has been shown to improve irritable bowel syndrome. And so the first thing that I tell my patients when they have symptoms of irritable bowel syndrome is change your diet and change some of your lifestyle. Take time for yourself. As working moms, as busy moms, like we have to put ourselves first sometimes, because if we are not calming our own body down, we can't function if we're having pain and distress. And, a very mild way to think about this is butterflies in your stomach. Everybody has experienced that, whether you're giving a talk or presentation or have something stressful at work or something's going on, you've had that. And that's a very mild version of irritable bowel syndrome. But, it's really important. I write down on a prescription pad for my patients, like take 5 minutes a day for yourself, doing something you want. Do something you like.
Exactly. And I mean, Dr. Sarina, I know you're a mom too, so you understand how important that time is, but also how easy it is to not take that time because there is so much going on constantly. But I mean, just, like you said, self-care is not selfish. It really is important for your overall health and for your gut health, and just so you can be better at your job or better at being a mom or a friend or, whatever you are. But it's so necessary. It's not just a luxury or, just because somebody has time, because nobody has time.
That's right. And it's so common. There's over 35 million Americans with irritable bowel syndrome. So this is not something unique. And it's because we live in this like hyper stressed out environment.
Right.
And the stress affects us in ways that we are only learning about now. It's like, oh yeah, I'm stressed out, but okay, now that stress is affecting my gut bacteria. There's actually been studies from University of North Carolina where I love poop, I guess, but they took poop samples.
No, I like this. I really haven't had a poop episode, so this is good.
They took poop samples from patients with irritable bowel syndrome, and there's 3 categories of irritable bowel syndrome. You can have irritable bowel syndrome where you predominantly have diarrhea. You can have irritable bowel syndrome where you predominantly get constipated, or you can have irritable bowel syndrome mixed. You're alternating between diarrhea and constipation. And they took the poop samples from those different patients, and they literally found that there are different gut bacteria makeups in each of those different types of patients. And so the stress is literally affecting our gut bacteria, and in turn, we're getting these symptoms.
And so is IBS probably the biggest condition that you see day in, day out?
I see a lot of irritable bowel syndrome, and I see a lot of constipation. So I actually, normally gastroenterology fellowship training is 3 years, and I did an extra year specializing in motility, so how our gut moves. And so I spend a lot of time with constipation and fecal incontinence. But constipation, there's 1 in 5 Americans suffer from constipation. And constipation can be from a number of different reasons. It can be because we're not exercising enough and our gut motility is slow. It can be from medications, especially opioids. And we have an opioid epidemic going on right now where these are pain medications, but they really affect our gut and slow it down so we get constipated. And then the third reason is that we are a fiber deficient country. And when we do not have enough fiber, we get a slow colon and we get constipated. And it's kind of interesting because you think about constipation as, I don't know, maybe not being that big of a deal, but I was involved in a research study at the University of North Carolina where we looked to see why patients were going to the emergency room. And constipation and hemorrhoids was one of the most common reasons that people end up in the emergency room.
Wow.
People are in such severe pain that they're going in, and then we do all this workup. We do CAT scans and imagings, and we just find out that they are like literally full of shit and constipated.
Yeah. I mean, we definitely live in a fiber deficient country. Like you were talking about earlier, just the average statistics of fruit to vegetable ratio to processed food that people eat on a daily basis is insane. Like, I have a lot of plant-based connections and friends now. So when I see people that don't do that at all, I'm just like, oh, I don't know. I could never do that anymore just because I understand how my body should feel and function. I don't know. This probably blows your mind too, Dr. Sarina, when you hear somebody say, oh, I haven't gone to the bathroom in a week. Or I'm like, what? How?
Yes. And I see that all the time. Like, I'm like, when was the last time you went? They're like, maybe 1 or 2 weeks ago. I'm like, this is not okay.
That is insane. I mean, like if it's not, what is it? I mean, every day, twice a day, then there's probably a red flag.
Yeah. I mean, you should be going to the bathroom once a day. Like technically the definition for constipation is you should have at least 3 bowel movements a week. And you have to have associated symptoms like bloating, gas, hard stools, you have to push. But that's like the textbook definition of constipation. Really, if you're not having a bowel movement every day, those toxins are staying in your body. You're not getting rid of those toxins. So it's no wonder that you're going to be bloated and having nausea and feeling full. So, the average American has about 10 to 15 grams of fiber a day. That's half of the daily recommended dose of fiber. And really, like when you look at people who have lived to be like 100 years old and healthy, and they're having like upwards of 50, 75, 100 grams of fiber a day. So, and you only get fiber from plants. And that's what people don't understand. Like you have to eat fruits, vegetables, seeds, nuts to get that healthy fiber. Fiber is an example of a prebiotic. And we haven't talked about prebiotics because prebiotics are different than probiotics. And so like probiotics are what you buy over the counter. They have the good gut bacteria already in them. It sounds like they have a lot because it's like 15, 30, 50 billion bacteria. But then when you remember there's 200 trillion bacteria, it's not that much.
Right.
And they're very short-lived. It's not, I don't actually usually encourage probiotics.
That's what I was going to ask if you recommend that or not.
I don't. Most of them are not FDA approved. There's a very, very small subset of patients that I would recommend a probiotic. Studies show that it works somewhat well when you take them, but as soon as you stop, then the effect stops. And so instead, I tell people to take prebiotics. And prebiotics are fruits, vegetables, fermented foods. It's things that we eat that are feeding those 200 trillion gut bacteria we have. So you're just going to get more bang for your buck. It's more cost efficient. It's just much better option. So I now incorporate fermented food into my diet pretty regularly. I used to never have fermented food. And so like sauerkraut, kimchi, kombucha,
Yep.
And now, like I didn't like kombucha I didn't like kimchi when I first had it, but if you take a small amount, like now I love it. So
I love it so much too. And I have a kombucha problem. I drink it all day. No, fermented foods are great. It definitely is an acquired taste. So if you are listening and you're like, yeah, I hate sauerkraut or I hate this, just try it with different mixes of foods, because it's amazing how it mixes with different flavors in different ways. And if you don't like something like kombucha, try different brands and different flavors, or if you want to make it yourself, that's amazing too. But there's a lot of kombuchas with different flavors and carbonation levels. So don't say no because you had one bad experience, because there's so many options.
That's right. And just start small. And,
Yeah.
I know you said you have a 3-year-old and I have a 3-year-old and 5-year-old, and my kids now, like they eat kimchi and they like kombucha. And so, one thing we didn't talk about yet, but for any moms listening out there, the first 2 to 3 years of life for a child is so important for gut health. And, this kind of goes back to like why I became passionate about gut health, is because the first few years are so important. After about 3 years of life, a child's gut microbiome and gut makeup will resemble that of an adult. And so as much as you can in those first few years of life, like trying to really encourage a lot of plant-based food. Like I make smoothies at home, and I mix in all sorts of fruits and vegetables so that they can get a variety of things. And that's really helpful for the future and for your kids, if you guys can do that. So
Absolutely. Because how many gut issues do we see day in, day out with kids that do have chronic constipation and just major fiber deficiencies? Most kids are definitely not getting the fiber that they need on a daily basis. Smoothies that you mentioned, that's one of the biggest ways that we do it over here. It's easy. You can make it taste good. Because I get even with, my daughter, she's been plant-based since day one. Like right now, she's been a little bit pickier lately. So even with having her palate a certain way, because I noticed she doesn't like super sweet things and things like that, which is cool. But she has been a lot pickier lately. So I have to get a little bit more creative and make more smoothies throughout the day to make sure she's getting that. And I'm sure you've had to go through similar things with that with both your 3 and 5-year-olds.
Yes, no, that's so amazing that she's plant-based from day one. And that you see, because I was not plant-based when I was pregnant with my first. And I was more plant-based by the time I had my second. And I can actually see the difference in the type of foods that they like to eat right now.
That's really cool.
And so it's kind of like, just an anecdotal thing, but I can see the difference in my own kids. So I try as much as I can. Instead of having potato chips on the counter, I try and have fruits and vegetables. And you just kind of got to make it fun for the kids.
Right. Yeah. Because most people don't want to sit there and eat a plain piece of kale. Like your kids don't either. So
right.
you definitely have to make it fun. You mentioned the just increasing fermented foods, increasing a lot of different varieties of fruits and vegetables. Is there other things people can be doing as well just to help with their gut health, help with bowel movements, just everything gut health?
Well, there's a lot of things that we can be doing. First is exercising. And that, is something that is important for our gut health. There is a prebiotic called butyrate, and exercise has been shown to increase that. So the more we move, the better it's going to be for our gut and our overall health. Actually, there was a study that came out, I think, just in the last few weeks. And this is kind of scary because nowadays we're seeing so much obesity and childhood obesity.
Oh, I know.
And they found that there has been a rise in 6 different cancers in young adults. So ages 25 to 50, which is kind of scary because that's my age group, Mm-hmm. And we are seeing such a rise in cancer because of obesity and gut health. And so I think just trying to have a healthy lifestyle in general is a good thing. What we eat matters, but also our environment matters. So whether we exercise, whether we take time for ourselves and reduce the stress, all of that affects our gut health. Smoking, that negatively affects our gut health. And so I think just being kind of mindful of all that is important.
Right. Just kind of that interconnectedness of everything. Because, you go for a workout, obviously it's going to affect you physically, it's going to help with gut health, but it's also at the same time going to decrease stress, which is going to affect gut health.
Yeah, and it's all related.
All of it. Yes. No, that's amazing, Dr. Sarina. I mean, I really love all of the work that you're doing. Oh, hey, something else I wanted to chat about for a second. You've checked out like Canada's new diet guidelines, right? Isn't that amazing?
Yes, that's amazing. So they cut out dairy.
Yeah.
And I think they've cut out processed milk, now I have to remember, and processed meats. I have to kind of review myself. I know they cut out dairy, which I think is amazing. And actually, that's been our hardest thing to switch over in my family because we have nut allergies. I'm allergic to nuts, as are my children. But I have recently switched over to oat milk, and that's been a great substitute.
That's awesome. Can you do like others as well, like hemp?
I've had hemp. Yeah, I just tried hemp, and I love that as well. And so unfortunately, I mean, almond milk, coconut milk, all that's so healthy, but I can't have that.
Gotcha. Yeah.
But I think that as much as we can cut out the milk, the dairy, when we talk about antibiotics, each of us takes antibiotics from time to time if we need to for an antibiotic or for a bacterial infection. But what people don't realize is that 80% of the antibiotics sold in the USA goes to commercially farmed animals.
Yes.
And we are getting antibiotics from those animals if you eat those animals or drink milk from those animals. And so, I think cutting that out is wonderful. And so I think hopefully the US will follow Canada's guidelines, but I think we are a ways away, unfortunately.
Yeah, I think, hopefully not, but I hope so too, because it really was crazy the jump that they made. I mean, they had a guideline that was pretty similar to ours. It was almost, it was very dairy heavy. I mean, to eliminate it something altogether is pretty progressive. And I'm glad that you brought up the amount of antibiotics that goes into dairy and meat as well, because it's insane. It's scary to think that a child is consuming that much antibiotics unwillingly. You're just getting it in the food, as well as things like birth control, or, they give chickens anxiety medication. You're taking all of this in, and it's just, it definitely is a recipe for disaster.
And people don't even know it. That's like the worst part is when people think that they're trying to be healthy, and there's so much misinformation out there. Like people are doing the keto diet and all sorts of diet, and they're doing it to try to get healthy because somebody told them this is the right thing to do, but we just don't realize how harmful it is. And so that's why I really try and focus what I talk about on the evidence. I am a physician first. I actually did an extra year in my training. I got a master's degree at the School of Public Health at the University of North Carolina. And I did that because I thought I was going to go into academic medicine. I love research. I think that's so important. And, we have to go off of what the research shows. And the research is showing you got to increase your fruit and vegetable intake. And one thing I tell people too is you don't want to have the same food every day because that's actually not that healthy. Your gut microbiome gets used to that. So you really want to switch it up and have diversity. Changing what you're eating, at least 30 different fruits and vegetables a week is the goal. And if you do that, then you're going to have good health. Yeah, no, that's definitely a big goal to, for a lot of people. But like you said, you have to have that diversity to affect your gut health. And to kind of touch back on what you just said about people jumping on to like the keto bandwagon or whatever kind of diet they're doing because they're seeing all these articles on these people that are getting in great shape. But I want to really emphasize to everybody listening that if you are trying to do those things, weight doesn't equal health. So somebody can somebody might lose a lot of weight doing these kind of things like keto, or they might get into amazing shape, but that doesn't mean anything when you look at like your gut health or what's happening internally. And I think people try to gravitate towards, they look great, they must be super healthy, but that's not always the case. And for a lot of the time, it's not the case. That's exactly right. And when people are doing like a calorie restriction diet, like 100 calories and from meat is not the same as 100 calories from kale. Like they're not the same. It's not the same calories. You have to really look at the nutritional value of what you're eating. Exactly. It's not always about the labels, right? It's about the ingredients of what's inside. So that is amazing. And Dr. Sarina,
is there anything that you are working on in the future that you just want to put out there and share with people? That way they can keep an eye on things you're working on, or just continuing to put out great content and help as many people as you can?
I am going to continue to do a few more podcasts. So if people follow me on social media, they're going to be able to listen to me more. I'm relatively new to social media. I've been giving a lot of lectures and conferences and talks over the last few years, but social media is a great way to reach a larger audience. And, when we see patients, we only get 15 minutes, and it's just not enough time to really get deep into the topic. So I love doing podcasts, and hopefully you guys will hear more from me on future ones.
Awesome. And what is the best way for people to follow you on social media? That way they can keep up with all of the podcasts that you do.
My main base is Instagram. I'm also on Facebook, and my username and my handle is @DocSarina. So DocSarina.
Perfect. I will put that. I will put those in the show notes. That way people can just go click and give you an ad. And then Dr. Sarina, just a closing question that I ask every guest. But if you just had one piece of advice for the audience, maybe it's been your own biggest takeaway through your wellness journey so far. But if you just had one piece of advice to give, what would it be?
I would say mindfulness. Everything that we do, our lifestyle affects us. And so being mindful of what we are putting into our mouths, being mindful of our environment, the stress, and our surroundings is really important. And if we do things mindfully, I think we'll all have good health.
Awesome. No, that's perfect, Dr. Sarina. And just thank you so much for taking time to come on. I loved having you and excited just to keep up with all of the amazing work that you do. So just thank you so much.
Thank you so much for having me, Dr. Casey.
Thank you guys so much for listening to today's episode. I hope you loved my conversation with Dr. Sarina. She's doing so much positive work, so be sure to give her a follow on social media to keep up with everything that she's been working on. You can find her social media links that we talked about in the episode in the show notes, but you can also find them on my website as well at drcaseyjohnson.com. That's drkaseyjohnson.com. Click on the Listen tab. Then from there, you'll be able to see all of the past guests that have come on the Unlock Wellness podcast, read a little bit about each guest, and be able to click on their social media links, websites, all of that. So all of Dr. Sarina's information can be found on my site as well. If you guys loved today's episode with Dr. Sarina, be sure to jump onto iTunes, subscribe, and write a review. It really helps me out a lot, and I really appreciate all of the feedback and support. Thank you guys so much again for tuning into today's episode. I hope you loved it. I hope it inspires you. And most importantly, I hope you take action.